For the first time in Grenada's history, its measles vaccine coverage has dropped from 95% to 84%. The Ministry of Health believes this is as a result of ongoing anti-vaccination campaigns across the globe. The anti-vaccination movement has a long history, beginning in France in 1763 and continuing through to today. The Ministry of Health says Grenada is required to have a 95% coverage level per community in order to avoid transmission. However, Carol Telesford-Charles, EPI manager responsible for immunization, says anti-vaccination groups have contributed to the drop in vaccination compliance and anxieties concerning vaccination.
Our coverage has dropped significantly. So for 2018, our measles coverage is 84%. So that tells us that there's an anti-vaccine population out there, and we really need them to get on board. We're supposed to achieve at least 95%, right? So we have dropped from the 95% historically, and it's now down to 84%. So that means that there is a vulnerable group out there who is not vaccinated.
The Caribbean sub-region was the first area of the world to eliminate measles. From 1991 through 2010, the 21 countries of the sub-region were remarkably successful in maintaining their measles-free status. Acting Medical Officer in charge of epidemiology in the Ministry of Health, Dr. Sean Charles, says people's attitude towards vaccination has changed.
Measles per se has not changed. All right? It is our attitude towards measles that has changed, and in part has resulted in the resurgence of this disease. Meaning that we now have persons out there and groups who are actively discouraging vaccination. As a result, we are having less and less persons willing to be vaccinated and to have their families, their children vaccinated. When this happens, the coverage level, you are required to have at least 95% vaccine coverage in a community to avoid the ongoing transmission of the virus. As a result of this hesitancy, all right, to vaccinate now, the coverage levels are dropping and the diseases are returning.
The Center for Disease Control has confirmed 704 cases of measles, the largest number of measles cases since 1994. United States media says all of the new outbreaks originally derived from infections transmitted by travelers, either visitors from overseas or U.S. residents who went abroad. Eugenia Peters, GBN News.